So what would you like to do with this monster? So there's now several possibilities. Some children like you to throw it, to hit it, to kick it. I might even provide the child with a hammer so that they can hit it. Some children would like to go outside and to, like jump on it or break it up in little pieces. And some will say, well, I want to break it up with my hand and I want to, I just want to make it in something that so that it does not exist anymore. So anything is possible, but let's say, for example, in this case, the child has thrown the monster and the monster is totally destroyed. All right, now the monster now is away. So now we move to the second piece of clay. And what I do now, the very important question is to ask the child, so how old were you when the monster came into your life? So, although children, especially younger children, because I do this from around about age 6 years, like we do with directive play therapy, maybe the child would not, on a cognitive level, understand why he or she say a specific age, but I've never found a case where the child don't say the exact right age. All right, so let's say the child is now 10 years, and the child said the monster came into my life when I was 3. What I would do then with the class, I would ask the child now to shape him or herself. Let's say in this case it's a boy. So I want you to make yourself with clay, with this clay, just a little rough, it doesn't have to be perfect, figure of yourself when you were 3 years of age. Now, so build yourself as a 3-year-old boy. Okay, let's see here if I can do that with my one hand. Okay, so that's the legs. Here is the arms and the head, maybe something like that. Okay, so now I would ask the child, can you tell me what happened that this monster came into your life? Remember, the monster carries an introject. Now, children don't always have the capacity to say what happened, but let's say in this case the child's a little bit older and the child say, well, this was when my baby brother was born, and my baby brother was born with a disability, and when he came into the house, my mom and dad have to spend all their time with him, and I felt like this anchor was holding me back because we couldn't go out anymore, we couldn't go for picnics, we always have to do what his needs were and so. Now, what is very important is that obviously a child would not be able to give all of these responses just out of themselves, especially a younger child. So you would have to use some questions, and can it be, and did you ever feel, and how did you feel when your brother was born, and can it be like that is the same as the anchor, that it just keeps you, like a ship where you have to be, and you're on a rope and you can't move. And, like maybe you feel trapped and stuff like that. Okay, so let's say the child say, yes, that is how I feel. Now you want to identify through your conversation with the child an inner core belief that was constellated in the child's psyche. Now, a core belief is now anything that we start to believe about ourselves or about life that is not true, but what was constellated at a young age in our psyche because of what happened. Like I said earlier, maybe it is my fault, or maybe if I want to go somewhere and my disabled brother is sick or is not okay, and I'm angry because we can't go, I'm extremely selfish. So, or maybe I'm just not good enough or whatever. So let's say in this case, the child got the inner core belief that you are very selfish and you're only thinking of yourself. So what I would do now is I would ask the child to pick up the younger part of themselves and keep it in their hand. And I would ask the child if they can talk to this younger part of themselves, and tell that part that you are not selfish and it is okay to have needs of your own. And it's okay to speak these needs of your own. It's also okay to want to go out and do some fun things when you're a child. So to have that need and to speak that need and to ask your parents if you can go is okay. And that does not mean that you're selfish. It's actually a good thing if you can do that. Now, I would obviously now in small sentences say to the child, let's say the child, for example, the child's name is Johnny. I would say to the child, can you talk to little Johnny and tell little Johnny that you are not selfish and it's okay that you have this, that you have needs and you allowed to have needs, and from now on I will allow you to have needs and I will take care of you, and I will allow you to speak up and to say what you need. If the child struggles to do that, me as a therapist, I'm just going to walk now here to the puppets. I will get a puppet here in my puppet box. So let's see, and that would be a puppet with a kind of a more neutral face. I think this one can work. Okay, so here is the little Johnny. So little Johnny would normally be in the child's hand. And now I'm going to take this neutral bear puppet. And the puppet is going to speak first to little Johnny. So I, as a therapist, will handle the puppet. So I'm just turning it here so that you can see see it on the DVD. But obviously the puppet will speak to the little child. And the puppet now would start off and say, "Hi, little Johnny. I hear that you for a very long time have believed that you are very selfish and that you are not allowed to have any needs and to ever ask your parents to go out. But I want to tell you that actually it's a very good and a very healthy thing to ask your parents for what you need. And although you can't always get that immediately, it is not wrong to ask. I also want to say to you that I can sincerely believe that you might feel trapped sometimes because you have a brother with special needs. And that makes that your parents spend a lot of time with the brother, and that then in that case that you can't go out on nice outings and so. So the puppet would say that to the little child, and then I would ask the child now to take the little child and ask the child if they can try to speak the same words to the younger self. So can you maybe try to say to little Johnny that, "Hi Johnny, you're not selfish for having needs. I understand that I understand that you have felt trapped for a very long time, and that you would love to sometimes just go out and do some fun things with your parents like other children do." So the child can then hopefully repeat this to the little child. So that would be the second part of this process. So the first part is connect to the monster, talk to the monster in the empty chair, and what would you like to do with the monster. The second part is find a time, at what age did this monster come into your life. For the therapist, help the child to connect that with a core belief like you're selfish, you're naughty, it's your fault, etc. And then help the child to start to nurture that wounded inner child. And that is where I then have used the puppet, so that the puppet can first talk to younger Johnny now, and maybe give younger Johnny a hug and help the child just to understand and to work on that deep-seated inner blame. Okay, but there's also a first part to this process, and what a third part. The third part of the process is now to give the child homework. So I want you at home to find something that can represent, that can be like this inner child, and I want you to every day as homework to repeat these words to that younger part. In other words, to keep on saying, you're not selfish, you are allowed to have needs, it was not your fault that this happened, and what can we do today, me and my inner child, to have a fun time. All right, and that is how the monster technique works, and that is a technique that works really, really, really well in the self-nurturing phase of the Gestalt play therapy process. And that is all for today. Bye-bye.